Yes.
Has the ACCARS data ever been matched with the homelessness database to sort of, I mean, is that possible to do to get an actual number of kids who age out and future homelessness?
It hasn't been done, and I don't even know if it's possible. It may be possible within a given state for states to match their child welfare data to the homelessness services data.
So you can't do that with the national databases?
Well, there's no national homelessness database that you would match it to.
Okay. Thank you.
Yes, in the back. Do we want people to give their names?
Hello. I have a quick question for the cumulative percentage you showed us for the Midwest study.
Mm-hmm.
For those states, what were their ages? Because as an age out youth myself, I wonder, were they aged out at 19? Maybe that's why the number went so low at 19.
That's a really good question. Yeah, so two of the states in the Midwest study, Wisconsin and Iowa, youth age out of foster care at 18. In the third state, Illinois, young people can stay in foster care till 21, and that is part of what you're seeing, why the number was actually low at age 19, because most of the young people in the state of Illinois were still in foster care. Then you see a jump at 21 when they all aged out. Other questions? Yes.
I'm curious, and I'm sure it might come up later too, but in the reference to the couch surfing, or whatever term you use, we call it doubling up in our community, but that seems to be an area where I feel like the numbers are really uncertain and raises the biggest concern about that. And I'm curious if how that's being recognized, I guess, in the research.
We actually have some data from the Midwest study. That was actually a separate question from the question about homelessness. So there was a specific question that asked about couch surfing, which we defined as something along the lines of moving from one place to another to stay with family and friends. So we actually have in the reports from that study, you could actually find the percentage of young people who reported experiencing couch surfing. Other questions? Yeah.
I'm just curious if there is any in your longitudinal study or anywhere, do individuals aging out of foster care become parents of kids that enter foster care?
Yes. Yes, that we do ask questions of the young people in our study about their children and whether or not their children are living with them. If their children are not living with them, we ask them where the children are living. So we have the numbers of children who are living in foster care. I don't know what the percentage is offhand, but we do have those data.
We have a question from the webinar audience, which is, are there studies about the impact of trauma on homelessness?
I believe that, I guess you could think about how trauma might manifest itself. So one of the things that we saw in the Midwest study data was that having symptoms of mental health problems were a predictor of homelessness. Now, not all of those mental health problems are necessarily attributable to trauma, but some of them may be. I don't know that any study has looked specifically at trauma, but I know a number of studies have found similar relationships between mental health and homelessness, as well as other potential symptoms of trauma, such as alcohol and drug abuse. We also saw in our data that physical abuse was related to homelessness, and physical abuse could be considered a traumatic experience. So I guess it really depends on how you're defining trauma.
I think everyone's very interested in the protective factors, and you're noting the protective factor of connection to an adult. How much detail do we know about that? Do we know what type of adult, what length of time the connection is, or is this finding really from a fairly simple question about connection?
The latter. So basically, we asked the young people how close they felt to various adult family members, parents, step-parents, grandparents. So it was, like Matt was suggesting, it was a fairly crude question. And that may explain in part why we only found some tentative evidence that if we had had a better measure of closeness, that we may have found a stronger relationship.
We have another question from the webinar audience, which is, did the study identify cultural or behavioral factors that are predictive or informative?
Well, in terms of behavioral, we found the link between engaging in delinquent behaviors and homelessness, as well as running away while in foster care. I'm less sure about the cultural factors. I'm not quite sure what that's referring to.
The audience member said that they were curious about belief systems or community ties or value systems as opposed to demographic or
Yeah, we didn't
characters.
really look at anything like that in its relation to homelessness as part of that.
Amy, I'm curious, once the young people, quote unquote, age out of foster care, is there a greater period of instability during a certain time? Is there, like the first 6 months that they age out of foster care or the first year, are they at greater risk of homelessness or couch surfing?
Well, it looks like the big bumps are sort of soon after they leave. So you saw if you look at that graph, so you saw when a lot of the young people left care in Illinois, we saw a big jump. And we also saw that the big jump between age 18 and 19, 11%. So it looks like that immediate period soon after is when at least some of this is happening. Although certainly there was continued people entering homelessness even further out.
I'm curious, I'm not sure if this is would be in relation to this topic, but I'm wondering what factors are being taken into consideration in regards to the length of time that each state lets a youth reside in foster care.
Do you mean the length of time that they were in foster care?
Well, no, like in Texas, it used to be you age out at 18, now it's 21. And every state obviously has a different age out limit. Do you know what factors are being taken into consideration to decide on how long they can stay under the government's supervision, if you will?
Oh, do you mean the factors that different states take into account when they're changing their policy?
Yes.
Is that what you're talking about? I think that's probably going to vary by state. It probably reflects a variety of considerations, some regarding fiscal issues, costs money to keep young people in care, also probably reflects the state's sort of ideology about its role as being a parent to young people and what its responsibility is. It may also reflect the sort of efforts of advocates in that state pushing for these kind of changes.
I was curious about the definition of foster care for the youth being served or aging out, because I know different communities also have different ways that services are provided, and I guess I was curious how you defined it for the study.
Right. So when we talked about foster care, we're talking about it very broadly defined. So not only traditional family foster homes, but also young people formally placed with kin by the state, or young people living in congregate care settings such as group homes or residential care. So broadly, out-of-home care that where the state has gotten involved. So not informal arrangements where a parent may have a young person live with a relative informally outside of the system, but this is where the court has gotten involved.
Thank you, sorry. Back to sort of the predictors of homelessness, is there any correlation between the age that somebody comes into a foster care setting and similar predictors that resulted in them going into foster care, resulting in them going into homelessness? So, did they come in as a young teen with delinquent behavior and they're male and they have mental health systems and that's what got them into the foster care system, and therefore that prediction was really evidenced prior to even coming into the foster care system? How's that for a complex question? Do those predictors exist before they enter the system?
So some of the factors that we found are factors that existed prior to the young person's coming into care. So the measure of physical abuse that we looked at was physical abuse prior to entry into foster care. That wasn't so those are factors that preceded their experiences in foster care. Some of the other factors we looked at were factors that may have occurred while they were in foster care. For example, running away while in foster care was a factor that occurred while they were in the system, or placement instability was a factor that occurred while they were in the system.
I have another quick question. So one thing I think about when it comes to 19 to 26, normally around 18, which was the original age that people were aging out, you may be going into school. So is there any factors that we're taking a look at youth who are on campus? Because normally around 23, 24 is when you're normally going to graduate. Mm-hmm. So I would wonder if there's a study looking at that age per se. So those youth are already aged out, they're done with college, because I know that's another big issue, mm-hmm. is youth going to school and don't have a place to go, during winter break. So is there any look at that? Because the age is very, I don't know, I think 26, that's the number I really can concretely understand as an alumni of the foster care system, and saying, okay, yeah, you have no other options. But now at 23, I'm still in school, so I may still have somewhere to stay. So did you guys look at that at all when you were looking at these youth who participated?
So we didn't look to see if the young people who were reporting being homeless were currently in college or had recently left college. What I can say is that we did look at the relationship between education and homelessness, and that was not significant in this analysis. But we didn't look specifically at the question that you're asking.
One of the things that you did not show is being related to homelessness, and it's a pretty obvious thing, so I assume you looked at it, is the length of time in the foster care system.
Right.
And you found that had no relationship to homelessness?
Not in our analysis, after controlling for all of those other factors.
Did you look at the placement settings, and was there any difference between congregate care versus foster homes?
So we did include variables that looked at whether or not the young people had been in a relative foster home, and we also included a measure of whether or not they had been in a group care placement. But I think some of what you're seeing is that some of the other variables in the model are highly correlated with group care. So for example, we know that young people often end up in group care because of behavioral problems, and some of the measures that we found to be related to homelessness, such as the delinquency measure and the measure of running away from care, may also be correlated with group care placement. So that may explain some of why you're not seeing that the placement type.
we have another question from the webinar, which is, do children of color run away relatively more from foster care? Do they end up at greater risk of homelessness?
We didn't find a relationship between race and homelessness in this analysis. So not in this particular study. And then I can say that in terms of the research on youth homelessness in general, the results are kind of mixed. So some studies have found higher rates of homelessness among youth of color, whereas other studies haven't found that.
Amy, in barriers to stable housing, you list child welfare system characteristics, and you talk about inadequate independent living preparation and lack of transitional assistance. Can you talk a little bit more about what that means?
So in terms of the inadequate independent living preparation, we were talking about actually the independent living services that young people receive while they're in care. Whereas the transitional assistance, we were thinking more about the assistance that would be provided to young people as they are aging out. Does that answer your question? Or
So what sort of examples were those child welfare systems lacking?
So this would be, for example, if young people are not provided with assistance in how to find housing, how to maintain housing, budgeting, which would allow you to maintain your housing, things like that. And then lack of transitional assistance could be things like not providing young people with any supports as they're leaving care to help them get their first apartment, for example, get set up, those kind of things.
Of those items that you have identified up there as barriers to stable housing, it looks like mental health is the only one that was also a predictor of homelessness. Could you talk about why you think those other ones didn't rise to the level of being predictive?
Well, I mean, I think that you could argue that maybe behavioral health also. We found a relationship between delinquency and homelessness. Again, we didn't find a relationship between having a criminal history. And then I think we didn't really look at, well, I mean, the family safety net, we as I said, we found that having close relationships with family seemed to have a protective effect. So we did find a few of them.
One more question? Anyone?
Yeah, I'm just going back to the initial question. Our homeless youth providers have to enter in a HUD required database. I assume that would roll up to the federal level at HUD. So, like SACWIS, would we be reporting AFCAR's data, et cetera? Isn't there a federal HUD database reflecting homeless youth? Apparently not.
No.
I'm just surprised by that.
Great. Thank you all. We'll move on to the next session then and invite Mike Pergament to the podium. Sorry, yeah.